Everyone. It's a great pleasure to bring to you some insights and advice and information from one of the great gifts that the Southern District of Texas has and the Fifth Circuit has. And that gift is Dr. Peter Hotez, who is a world-renowned physician scientist specializing in vaccinations. Dr. Hotez knows as much as, if not more than, any other human being on the planet about vaccinations and COVID. He has been one of the people instrumental in developing the Moderna vaccine and in developing the science of why it works, why it matters, why it's critically important for everyone to get vaccinated as soon as they can. Dr. Hotez came to Texas from a distinguished career, first with a degree from Yale, a Ph.D. in biochemistry, and an MD from the Weill Cornell Medical College. He has authored more than 500 pages. He's authored 4 books, and he is a pioneer in the field of vaccinations. He has been the major force in developing vaccines that have cured tropical diseases in many parts of the world, including Africa. And he has been incredibly important in developing the vaccination for COVID. You've probably seen him on CNN or other information programs. Second only to Dr. Fauci, he has become the voice of all of the reasons behind the importance of getting a COVID vaccination and the availability of that vaccination. He has agreed to talk with us about why getting vaccinated is so important. And it is with great pleasure that I present to you Dr. Peter Hotez from Texas Children's Hospital, the Baylor College of Medicine, and speaking to our court. In addition to the information that Dr. Hotez will give us, I want to remind everybody that you do get 4 hours of admin leave to go get vaccinated. So there is no personal leave that has to be taken to do so. Dr. Hotez, the floor is yours.
Do you have any data on who's already gotten sick from COVID?
We've had one fatality, actually 2 fatalities within our court employees. We've had a number of people who have been sick, ranging from people who work within chambers for individual judges to some of the marshals and security people and some of the people within the clerk's office or probation. Several were very, very sick. Sorry.
No, well, they're certainly at high risk for a number of reasons. One is the character of the epidemic is about to change yet again, in that, especially in Texas, Georgia, and Florida, and I'm going to guess soon everywhere in between. So that whole area of the Gulf Coast, including Texas, is at great risk because of this B.1.1.7 variant that originally came out of the United Kingdom. There's a group that the CDC is contracted with called Helix to do all the genomic sequencing, and they're saying up to 50% of the virus is isolated in Georgia, Texas, and Florida are the B.1.1.7 variant. And the reason that's of concern is now there's published evidence showing that it's higher lethality than what we've seen before, and about 60% more transmissible. So as bad as things have been, there's a lot of worry that if we don't vaccinate ahead of this variant, it could really cause a lot of destruction, even worse from what we've seen previously. So that's a big factor The second factor, of course, is the governors lifted the mask mandate, which I think was premature, especially because we have the third concern in that we've fallen behind in terms of vaccinations. So we're reaching soon about 25% of the adult population that's gotten at least a dose of the vaccine, and as high as almost a third in New Mexico. But Texas and some of the southern states are further down the list, and Texas is underachieving, in part because we lost a week because of the grid collapse, but also because it's a big state and other factors as well. So we're not doing as well. So what I worry about is this perfect storm of the B.1.1.7 variant, the underachieving of vaccinations, and the premature lifting of mask mandates put your employees at particularly high risk, even compared to the rest of the country. So I think that's an important consideration. The other
Dr.
problem,
Hotez,
yeah,
can I ask whether the vaccination will protect against the variant? Just as the lack of vaccination leaves us more vulnerable, will getting vaccinated protect against that increased risk?
so far all of the Operation Warp Speed vaccines protect equally well against the original strain and the UK variant, the B.1.1.7 variant. So yes, the one that it may protect less is of relevance are the South African variant and the Brazil variant, and they are in Texas, but they don't seem to be as accelerating as much. However, the Brazil one, the P1, seems to be coming up because it's now taking over Western Brazil, and you start worrying about Central America. And right now, not the most pressing issue, but we may want to park that for later on. I think the other big worry and the fourth big factor is the fact that the narrative that's out there is that the people who get sick and go to the hospital or lose their lives are all over the age of 65. And it's, well, overall it's not true, but particularly among Hispanic and African American minority groups, a third to 35% of the deaths are under the age of 65. So people in their 40s and 50s, black and brown communities, 40s and 50s, especially low income neighborhoods. And I'm guessing a lot of your employees fit that description. So that's an extra reason for concern. So when you hear about, oh, this is just a disease of illness of, it's illness of nursing homes or people over the age of 65, it's not true. We're seeing lots of people losing their lives in their 40s and 50s, and now we know about 30% of people who are infected are developing potentially long haul COVID, meaning associated with brain fog and depression and long term pulmonary and cardiovascular conditions, and we haven't even accommodated the medical system to manage that. So all of these things point to one thing: we need to get everybody vaccinated as quickly as possible, and we've got to make that a priority, particularly because all your employees, they're on the front lines, they're interacting with people. That's their job, to interact with people, interact with the public, whether it's jurors or people in the prison systems, or all the kinds of things that they do. So I see the people you're describing as a priority for getting vaccinated.
Is there any reason that any of our employees should hesitate about getting a vaccination?
No, I mean, the only contraindication is if you have a known allergy to a component of the vaccine, which is extremely rare. And the only ones that we're seeing is there's a component of the vaccine known as PEG, polyethylene glycol, and it's a rare allergy. And PEG, or polyethylene glycol, is a food additive. So if you had it, you would know it. Um, it's extremely rare. So for all practical purposes, practically no. Even now, we're recommending it for pregnancy, even though not all the data is there, because pregnant women especially do not do well with COVID-19. 60% higher rates of hospitalization and ICU admissions and ventilator requirements. So even though we don't have all the information about pregnancy, the American College of Obstetrics and Gynecology is saying, they should be, pregnant women should be offered the vaccine because of the dire consequences of being pregnant and getting COVID-19.
Dr. Hotez, if someone decides not to get vaccinated, what risk do they pose to people they work with, people they love, people they come into contact with?
Well, we've gotten now some new information about vaccines that's very positive. We've known now since the phase 3 trials of these Operation Warp Speed vaccines that they halt symptomatic illness. But now the studies coming out of Israel that was recently published in the New England Journal of Medicine, and now the Israeli government's provided additional information. 2 doses of the Pfizer-BioNTech vaccine is also halting asymptomatic transmission. So you're also stopping transmission. And we think the other vaccines will perform in a similar way. What it's stopping is virus shedding from the nose and mouth if you get exposed. The good news means that if we can vaccinate a significant percentage of the American people, I think we can vaccinate our way out of this epidemic, stop transmission, and then later in the summer, maybe even masks can come off. And I don't know that life will be completely normal, but looking much better than anything we've seen before. So by not getting vaccinated, it does a number of things. One, to put yourself at risk for hospitalization and death for all the reasons that we've been talking about, but also it means that you potentially, even if you're asymptomatic with infection with no symptoms, and about 50% of people are, it means you're infecting everyone around you that you're interacting with if you're not getting vaccinated. So this just raises the stakes at every level for the importance of getting vaccinated.
And if you don't get vaccinated, will herd immunity protect you eventually? I mean, can you just wait and still be responsible and careful?
Herd immunity is unfortunately an elusive concept. It's thrown a lot. It's been so politicized, of course, and unnecessarily so. But it's a bit ethereal, a bit unclear whether it even actually occurs. We thought for certain that we had our arms around this in Manaus in Brazil, where 66% of people got infected, but then the P1 variant came along, and people are getting reinfected. So yes, we think herd immunity can occur, but it's still unclear, and you certainly do not want to have your life depend on herd immunity from others. And even then, herd immunity doesn't really affect the individual. It just says statistically you're less likely to get it if herd immunity takes place, but it doesn't mean, even if herd immunity is well established in the community, you could still get it, right? Just like measles, right? Even though, most communities in Texas have herd immunity to measles, or at least the kids do, if you're not vaccinated, you can still get measles.
Judge King, do you have questions?
No, I think this has been really helpful. You're terrific.
You are terrific, Dr. Hotez. And
Sure.
If you have one final message to our employees, what is it?
These vaccines can save your life. We've shown that. It's incredibly liberating. In time, it will mean that you can travel without fear. It means that you can see your friends and family without fear. We don't have all the performance indicators of the vaccine, but it's clear it's going to save your life, and clear that now it's going to stop transmission. So if you care about not only forget about yourself, you care about your loved ones, the best thing you can do is get vaccinated and get your loved ones vaccinated.
And I think the best thing that we can do is thank you for all the work you have done. You have truly saved lives, and we are grateful. We are incredibly grateful. We owe you, Dr. Hotez.
Thank you, Judge Rosenthal, and as I said, thank you for all your support of the institutions in the Texas Medical Center as well.